On to hypoparathyroidism. We have 5 slides with hypoparathyroidism. Hypoparathyroidism is decreased function of the parathyroid gland, which is lack of parathyroid hormone. Causes are iatrogenic hypoparathyroidism, maybe from surgery or radiation. Idiopathic hypoparathyroidism could be autoimmune, or hypomagnesemia. Looking at our notes here. So the decreased function of parathyroid, lack of PTH. With this hypomagnesemia, remember magnesium has a major role of PTH secretion. It works good with calcium. So when magnesium is low, there's a decreased secretion of PTH from the glands in patients that have high levels of serum magnesium. There is also impaired secretion of parathyroid hormone. So if low magnesium, they're going to have low levels of PTH. Parathyroid hormone is low with low magnesium. Assessment findings for a client with hypoparathyroidism: you're going to have tingling or burning, paresthesias in fingertips, toes, and lips, muscle aches or cramps affecting legs, feet, abdomen, or face, twitching or spasms of muscles, particularly around mouth, hands, arms, and throat. Other signs and symptoms of hypoparathyroidism is fatigue or weakness, dysmenorrhea, patchy hair loss, dry, coarse skin, brittle nails, anxiety or nervousness, headaches, depression, mood swings, memory problems, and Chvostek and Trousseau signs indicating hypocalcemia. Remember, with low calcium, you have low magnesium. Lab and diagnostics for hypoparathyroidism would be to check the parathyroid hormone, check the blood serum calcium and phosphorus, check albumin blood work, and 24-hour urine calcium and creatinine. What should be the plan of care for a client with hypoparathyroidism? You want to correct the hypocalcemia, vitamin D deficiency, and hypomagnesium. So you want to correct the low calcium, low magnesium, vitamin D deficiency. It will have lifelong replacement will be necessary. Maintain phosphorus in high normal range. So this would contain 40% elemental calcium or calcium citrate, which has 21% elemental calcium. Phosphorus should be maintained in a high normal range with people that have low parathyroid hormone. What medications should be ordered for a client with hypoparathyroidism? Calcium replacement. If calcium is low and severe, then you would use calcium through the IV replacement. Acute and severe IV replacement would be 10% calcium chloride or calcium gluconate over 10 to 15 minutes. Long-term calcium use, you do 0.5 to 2 grams per daily in divided doses. We have that on the PowerPoint here at 0.5 to 2 grams per daily in divided doses. 3 servings of dairy products would be necessary for hypoparathyroidism. Vitamin D deficiency. For acute, you'd use calcitriol, 0.5 to 2 milligrams per daily microgram daily. Long-term would be calciferol, 50,000 to 400,000 units for long-term vitamin D. And if the patient has acute, you would use acute hypomagnesemia, 50% magnesium sulfate in 2 milliliter doses. So this completes our hypoparathyroidism. Remember, it has symptoms of low calcium, low magnesium, which is the positive Chvostek and Trousseau sign. And that wraps up. You have decreased function of parathyroid, so you don't have PTH hormone, which is necessary to raise the calcium. So these are the symptoms of that.